conservative dentistry versus more aggressive dentistry. There is a time and a place for both. I try and get to know my patients and develop a history of visits so that I can see how their mouth trends. With somebody that, gets cavities frequently or often, I will probably be more likely to recommend doing a treatment more early than on somebody who rarely gets cavity or has any dental issues. On some people, we might see something that is very early stage and they rarely get any dental problems. And, we may keep an eye on it and take x-rays every 6 to 12 months and make sure that it's not progressing. But on somebody that gets a cavity almost every time they come in, if I see an early stage lesion, then I'm probably going to say, let's go ahead and take care of this now, because it's very likely going to be much bigger next time I see the person for their cleaning and checkup. I don't think there's a one size fits all. I think what we try and do in our office is just, get to know the patient. And I'm not an aggressive practitioner, but I'm not overly conservative when that won't benefit the patient either. I try and customize it to fit, the person in front of me. And so sometimes I'm very conservative with somebody that's appropriate for, and then somebody that, needs some intervention, we got to do that, or else we're looking at a bigger problem in potentially a short period of time. So I don't think there's really cookie cutter, I do it this way every single time, but I don't like doing treatment that's not necessary. And I always, think about it, if this were my mouth, what would I do? If you kind of keep that philosophy, then I think you end up being somewhere in the middle most of the time.